My name is Mario Nunez. I live here in Thornton. I came from a broken family. My dad left the home. My mom, she never recovered from it. She was a very unhappy woman, and I used to see that. She used to drink a lot to try to forget things. She was a great cook, all those great things. But I was drinking myself. There was always beer in the house, always parties, and I was 13 when I took my first drink. That's where my alcoholism started because I never stopped drinking after that. I ruined my life with my wife, my kids. I sacrificed my home over alcohol because I didn't know any better. It was very dramatic and it really broke my heart. Just led me to drink more. And I'm 63 now, and I just recently started trying to working on my alcoholism. COVID kind of set me off I was already an alcoholic. I was already trying to deal with that. I didn't have the support or the help that I needed. I ended up getting 2 heart attacks over it because the alcohol wasn't allowing me to take care of myself for the last 7 months. I was in need of care.
So, a little bit about Mario. He's a patient here at Tepeyac Community Health Center. All around, just a great person. Wears his heart on his sleeves, genuine, honest, part of the team, part of the family as he says it. So his initial visit, he met with someone from enrollment and they welcomed him, they got to know him financially. The purpose of that is to really get some of the barriers away that our clients face, economic barriers, literacy barriers as well, to really empower them, meet them where they're at, and find a way to help them get to their needs and get the care that they deserve. Recently, one of our case managers met with Mario and helped with an application for housing for assistance. And I know that was very impactful for him. And talking with this person, that was a very powerful interaction that they had with Mario. And of course, we staff with other members, team members, providers, behavioral health providers, dental, case management, enrollment. I think it's fundamental to have that structure to wrap around and include those services that sometimes we take for granted.
So often you think of going to a doctor's office and speaking to a medical provider and just dealing with the physical aspects of a disease. But we know that so much more of one's health is dictated by their mental health, their social situation, the stresses that they have, their finances. I think my definition of health is that a person or a patient feels empowered, that they're making the changes that they want to see in their life.
When I came here, this was all new to me. I mean, all my life I've been trying to get medical assistance to help me, but it wasn't easy. Cost of living, cost of life. This was all new to me. I wanted it. I needed it. I had to have it. My body was talking to me. I don't want to die an alcoholic. But through the support of Dr. Huffer and his medical assistance that he gave me, and then he also requested or asked me if I wanted to talk to a therapist, and I said yes. I need all the help I can get because I don't understand what's going on with me.
So with Mario, the kind of care that he gets with me is just a place to listen and really work with himself, reauthoring and just healing some of the things from the past that he doesn't think are so pretty about himself that are broken. My main purpose with him is really holding him accountable for his healing, holding him accountable for his self-love, and holding himself accountable to give himself permission to be human above anything else.
I just feel, when I come here, I feel at home. And I just that's why I'm here. That's why, yeah. I'm taking care of my dad, and I'm learning. I'm growing from it. My dad, you know, he's 83 years old and he's alert. I sit down and I talk to him and share with him a lot of things that that are important to us both. I'm blessed, you know, because I'm learning a lot about myself, and I couldn't have done it without my therapist or my doctor.
I think the power of Tepeyac is the welcoming, humanistic care that we provide here. Everybody who walks through the door is met with a whole team, from the people who answer the phone calls, the person who draws their blood, to the medical providers, to the behavioral health providers. Everybody is here to serve a patient and to let them know that they have human worth.